Okay, so today I'm going to talk to Sarah about diabetes. So, diabetes is a chronic disease where the body can't regulate glucose within regular limits, and there's two types of diabetes. Today we're going to be talking about type 2 diabetes, which can happen because of either obesity, genetics, age, or if you live a sedentary lifestyle. So, basically what happens with diabetes, and I have a picture that shows here. So it shows, here's the normal, what happens in the bloodstream. The glucose and insulin get released into the bloodstream. Insulin acts as a key into the blood cells, and then we go down here, you can see the insulin is filling in that little keyhole, and the glucose is allowed to pass through into the blood cells. This is what it should normally look like. And then in type 2 diabetes, the insulin can't open the door for the glucose. So, as you can see, it's marked by the X there. So, when the insulin can't do that, there becomes this buildup of insulin and glucose around the blood cells. And this happens because your body is trying to make up for the imbalance by sending more glucose and more insulin out. And then there just becomes this buildup, and it's very bad. It can lead to lots of complications, and it can also lead to things like heart attacks and eye problems, as well as hypertension and kidney disease. So, so far, do you have any questions?
What do you mean by a sedentary lifestyle? What is that?
So that's just somebody who doesn't really do a lot. They're not really active. And they kind of just sit around all day and they don't do much.
Oh, okay. And that can actually cause diabetes if does it have to be like in length or a long time that someone's doing that?
Yeah. Okay. So some signs and symptoms to look out for if you might have type 2 diabetes. Hopefully you don't. You would always be tired, frequent urination, sudden weight loss, blurry vision. You could also have sexual problems, infections in your genitalia. Sudden weight loss is a big one. Your wounds will heal slower because your blood isn't being allowed to get the blood sugar it needs.
Right. Right.
And then another one is you're always hungry, or you will have numb or tingly hands and feet. So that's what you should look out for. That is type 2 diabetes. I hope you learned something.
I did.
And there you go.
Thank you.
You're so welcome.